This video details how an active Toronto medical clinic achieved PHIPA-compliant speech privacy in 3 days without tearing down a single wall through zero-demo acoustic surgery. Physical walls can be the greatest threat to data security, leading to accidental eavesdropping and liability, including direct violation of PHIPA. Sound behaves like water, relentlessly seeking the path of least resistance. Hollow commercial partition walls can amplify and transmit human voices, and voice energy can bypass the wall entirely through the ceiling plenum. Traditional contractors take 14+ days, require the clinic to close, and result in significant lost revenue. Inaudible zero demo, using surgical wall injection and ceiling flanking control, takes 3 days, keeps the clinic active, and results in 0 lost patient hours. Phase 1 is containment and the zero trace protocol. This involves industry-standard mitigation, poly-sheeting barriers, and plastic drop sheet coverings to protect all clinical surfaces and isolate the work zones. Phase 2 is surgical wall injection. Step 1 is access, drilling 4-inch surgical access ports. Step 2 is dense fill, injecting high-density cellulose fiber insulation at high pressure. Step 3 is restoration, patching and sanding the access ports seamlessly. Phase 3 is sealing the ceiling plenum. This involves installing a high-mass acoustic barrier to sever the over-the-wall flanking path, securely trapping sensitive consultations inside the room of origin. Privacy is achieved with an STC 50+ rating, 100% PHIPA-compliant protection, 0 visible traces, and 0 lost revenue. The work was completed in exactly 3 days. Secure your space with surgical, zero-demo acoustic integration to protect your practice without closing your doors. Do not wait for a compliance audit or a lost patient.